Good day everyone, and you're welcome to this platform with Doc Imoje, where we talk about things regarding our health. So today we are going to quickly look at the 19 causes of erectile dysfunction. Now, what is erectile dysfunction? Erectile dysfunction is the inability of a male to maintain erection, or the inability of a male to maintain proper erection. So the causes and risk factors include the following. 1. Prostate issues. Yes, when there are prostate issues, there will be problem with erection. There are so many men who actually have prostate issues like benign prostatic hyperplasia, prostatitis, and the rest of them. There will be problems with maintaining an erection because the prostate is a gland that is located just behind the penis, and it helps with ejaculation. It also helps with nourishment of sperm cells. So if there is a problem with the prostate gland, there will be problems with ejaculation. There will be problems with erection as well. Now the second is diabetes, type 2 diabetes. High blood sugar also affects erection. When a person has diabetes, the uncontrolled blood sugar will affect erection because erection comes as a result of increased blood flow to the spongy tissue of the penis. So when there is a problem with proper blood flow, such as what we would see with uncontrolled diabetes, uncontrolled blood sugar, there will be affection of erection. Now, another one is hormonal problems, hormonal issues, hormonal imbalance, and something we call hypogonadism, because there is a gland called the pituitary gland in the brain that also controls the hormones. It actually controls the hormones. It's a complex network of hormonal function, which I am not going to look into here. So when there is a problem with hormonal physiology, there will be a problem with erection. For example, hypogonadism as a result of affection of the pituitary gland in the brain, which affects overall hormonal function, can lead to erectile dysfunction. Now we have vascular disease. Vascular disease meaning disease with blood vessels. Remember, we had already said that erectile dysfunction can also result from problems with blood flow to the spongy tissue of the penis. If there is any disease that affects the blood vessel, there will be problems with erection because that is the primary function of blood vessels present in the penis, is to maintain erection. So problems also like sickle cell anemia, problems like vasculitis, like infection that leads to inflammation of the blood vessels, will not allow blood flow properly and blood empty properly, and this will affect erection. So another cause is high blood pressure. As we know, high blood pressure is the silent killer, and the cause of high blood pressure is actually as a result of narrowing of blood vessels, leading to an increase in the pressure of blood flowing through them. And if these blood vessels are narrow, we are actually going to have problems with maintaining erection. Yes. So there's another major problem, which is something that has to actually do with cholesterol. Yes. High amounts of cholesterol in the blood can actually lead to poor erection. This is because when you have high amounts of uncontrolled cholesterol in the blood, they can actually line the walls of the blood vessels, leading to an impairment in blood flow, and this will actually affect erection. And then we also have what we call the low density lipoproteins and the high density lipoproteins, what I would just generalize as the blood lipoproteins. These lipoproteins have their special function, but then a disbalance between the low density and high density can actually lead to problems. Not to make it very complex, I would just say the high density lipoproteins is the good lipoprotein. It actually helps with lipid or fat metabolism. And then the low density lipoproteins is actually the bad lipoproteins, but it's bad when it's in high amounts. So when you have high amounts of these low density lipoproteins, it actually leads to what we call atherosclerosis. It actually leads to the same effects with high blood cholesterol. You have these lipids, these fats lining the blood vessels because we do not have enough high density lipoproteins to help clear off this mess, and then it can actually lead to heart problems as well as erectile dysfunction. This is just to simplify. And then we also have stress, which can be brought about by chronic sleep disorder. Yes, indeed, stress is a contributory factor when it comes to high blood pressure, when it comes to improper erection, when it comes to a whole lot of issues with health. And now we are looking at erection in this case. So when we have psychological issues, stressors, a lot of unrest, it could actually affect erection. It could actually affect a man's performance. Yes. So we also have drugs. There are different kinds of drugs, including antihypertensive drugs. Some antihypertensive drugs also can affect erection, most especially some group of beta blockers. So they actually affect erection. We also have what we call the neurogenic disorders. Neurogenic disorders such as diabetes, such as multiple sclerosis, such as stroke, such as spinal issues. These can also affect erection. Then we also have what we call Peyronie's disease. Peyronie's disease has to do with an abnormal curvature of the penis. So this can actually affect erection because if the penis is not properly shaped, if we put it that way, if the penis is not properly shaped, there would be problem with the way blood flows through the spongy tissue of the organ, and this would also affect erection. Then we also have what we call priapism. Priapism is sustained erection, usually seen in some patients with sickle cell disease who have crisis, because the sickle cell blocks the drainage of blood in the spongy tissue, and this can actually affect erection, and it can lead to sustained painful erection that, if not corrected, can actually lead to serious medical problems. Now we also have depression. Depression, which is a psychological issue and a stressor, can actually lead to erectile dysfunction. And we also have alcohol use. Yes, excessive use of alcohol can lead to erectile dysfunction. Another cause is lack of sexual knowledge, because some people do not even know how to satisfy their significant other, and then it becomes a stressor for them, and then over time it can lead to improper erection because of this stress that it creates, or this anxiety to perform. Then we have poor sexual technique, which is as a result of what I had said earlier. Poor sexual technique can actually lead to erectile dysfunction. Then renal failure. Renal failure is a problem because toxins are accumulated in the blood, and this can actually lead to improper erection. Then smoking. Of course, smoking can lead to destruction of the blood vessels, and this can affect erection. Age. The older one is, the lesser one is able to actually maintain proper erection. There are different types of erectile dysfunction based on the cause, based on the pathophysiologic mechanism, and some of them include the organic erectile dysfunction, premature ejaculation, and reduced libido. In organic erectile dysfunction, it is based on the cause. It is based on an underlying issue with the patient, such as an increase in age. As we have explained before, the more a patient ages, the more there are risks of erectile dysfunction, because the blood vessels begin to narrow, and of course, body function is not the same as when the patient was younger. Other conditions such as atherosclerosis, which is a deposition of fat on the blood vessels as a result of poor blood cholesterol control. This deposition of fat actually leads to formation of clots, which can complicate with strokes, heart attack, and other complications, as well as narrowing of blood vessels, which would also impair blood flow to vital organs, as well as the penis, which would also affect proper erection. Smoking is also another problem, because smoking irritates blood vessels, causing them to get inflamed and then not function properly. This leads to narrowing of these blood vessels and, of course, affection of erection, as well as proper blood flow to vital organs. When we are talking about premature ejaculation is a condition whereby the affected patient ejaculates even before vaginal penetration. This is also an inability to delay ejaculation before vaginal penetration. Reduced libido can be as a result of so many other causes. It could be psychological, it could also be as a result of hypogonadism, it could be as a result of hormonal imbalance, where the affected person is not in the mood or is not actually aroused, and this can actually lead to an affection of erection. Knowing perfectly well that there are so many issues that can predispose to erectile dysfunction, from liver issues to kidney issues to blood issues to so many problems that many patients can present with. When we want to make a diagnosis of erectile dysfunction, there are so many things that must be looked at. The history is a very important factor into determining what the cause of erectile dysfunction is. There are some blood tests that will also be taken, hormonal blood tests, electrolytes, urea, and creatinine, or what we call the EUCR blood test. In fact, even the full blood count should actually be taken. Apart from that, liver function tests should be taken. When all these tests are taken, then a proper history can be followed, and then a proper diagnosis can be made. A prostate exam is also another important step towards the diagnosis of erectile dysfunction. Very, very important. Another important test in this scenario is the lipid profile, because we have actually mentioned that increased blood cholesterol leading to atherosclerosis can actually be a precipitating factor to erectile dysfunction. So it's very important that patients also do lipid profile, most especially patients in their 40s and above, and also blood sugar level, blood pressure, as well as so many other tests that will be discussed at the doctor's office during your visit. When we are talking about the treatment of erectile dysfunction is based upon the patient's presenting complaints. It's based upon the history, because there are different kinds of treatments that would actually affect the patient based on how the patient presents. Not one treatment works for every patient. There are different treatments that actually work for different patients. Now, when we want to talk about the treatment of erectile dysfunction, like we have said before, it is individualized depending on how the patient presents and what the complaints are. Most of the time, erectile dysfunction is actually as a result of psychological strain, psychological issues. So the cause of the problem should be identified before any other thing is done towards the treatment of this condition. many men actually have anxiety or performance anxiety, which actually leads to erectile dysfunction, and this should be addressed. Generally speaking, the treatment is based on the age, the health, as well as the medical history of the patient. What does the history say? What is the complaint? What are the presenting complaints? Now, it also depends on the extent of disease in this case. How is the progression of the disease like? It also depends on whether this patient will be tolerant to treatment when the treatment has actually been initiated or when drugs have actually been prescribed. Now, there would also be a case whereby the opinion of the patient would become a factor here. What does the patient think about the history that is on ground, or the history that has been presented by the patient himself? What does the patient think? Is there any other thing that the patient would like to share? So these are various issues that are very important when it comes to the treatment of erectile dysfunction. Now, when we are talking about different drugs, there are different drugs that help with erectile dysfunction, and they include sildenafil, which many people know as Viagra. There is tadalafil, and this particular medication is similar to sildenafil. And then we also have the drug vardenafil. So these are actually very similar medications that are used to treat erectile dysfunction. The mechanism of action of this drug is that they increase blood flow to the penile tissue, and this actually aids erection. But it should be noted that many patients who are on drugs such as nitroglycerin for angina pectoris or for heart-related issues should not use sildenafil, because this could actually crash the blood pressure to dangerous levels. So it's very important to visit your doctor before taking any medications and ask any questions if you have any concerns. Now, it should be noted that sildenafil or Viagra should be taken on an empty stomach. Tadalafil takes 4 to 5 hours before it begins to work. And we should also note that other treatments include hormone replacement therapy. Hormone replacement therapy for those with hypogonadism or for those with low testosterone levels. It should be noted that hormone replacement therapy should not be given to men with normal testosterone levels, as this might increase the risk of prostate hyperplasia or prostate enlargement. Other treatment options include penile implants, which can be divided to the inflatable or the semi-rigid. So these implants are put in the penis and then controlled by the patient. So in order to achieve an erection, there would be a maneuver which would allow this be a possibility. So it's very important that these problems with erection should be found out and appropriate action with your doctor's orders taken. Do you need herbs for erectile dysfunction? Well, no. Why? Because when we actually go back to the causes of erectile dysfunction, you would actually realize that so many diseases can affect erection. High blood pressure, diabetes, age. So what are these herbs going to do for you? You do not actually need herbs. Before you use any medications, consult your doctor. Another major treatment of erectile dysfunction is treating the underlying cause. For those with high blood pressure, treat your high blood pressure, treat the diabetes, treat the high blood cholesterol, exercise daily, drink enough water. For those with sickle cell, take your preventive medications, make sure you stay hydrated, make sure you visit your doctor for your routine checkups, as well as those who are elderly. Visit your doctor for routine checkups. Check the medications you are using. If there are any medications that may be leading to erectile dysfunction, for example, some antihypertensives such as beta blockers, they can be reviewed by the doctor, doses changed, or the medication switched to a new medication. These are some of the things that can be done. And then, if there are prostate issues, these prostate issues should be treated. And if there are any issues wrong with the tissue of the penis itself, surgery is also an option. So do not let anyone deceive you that some magic drug or some magic herb would cure the issue when there is an underlying issue that needs to be treated. So we are going to look at other issues with health in next coming videos. Thank you very much, and do have a lovely day.